In Week 5, we examined cognitive behavioral and self-regulation interventions as evidence-based tools within special education. These interventions are especially important for students whose learning is affected by anxiety, anger, impulsivity, or difficulty regulating emotions and behavior. At the doctoral level, the central question is not simply whether an intervention works, but for whom, under what conditions, and how it can be integrated ethically and effectively into individualized supports. Cognitive behavioral therapy, or CBT, is grounded in the principle that thoughts, emotions, and behaviors are mutually influential. In educational settings, CBT helps students identify maladaptive thought patterns, reframe inaccurate beliefs, and practice coping responses. For anxiety, this may include recognizing anticipatory worry, using gradual exposure, and rehearsing calming self-talk. For anger, CBT can support students in identifying triggers, interpreting social cues more accurately, and replacing reactive responses with problem-solving strategies. For emotional regulation, CBT encourages metacognitive awareness. Students learn to notice internal states, label emotions, and select strategies before escalation occurs. Self-monitoring and self-management are closely aligned with CBT and are particularly powerful because they shift part of the regulatory process to the learner. Self-monitoring involves students systematically observing and recording their own behavior, attention, or emotional state. Self-management extends this process by pairing monitoring with goal setting, self-reinforcement, and reflection. Research consistently shows that when students are taught to track their own progress, performance improves because regulation becomes visible, measurable, and actionable. In inclusive classrooms, these strategies can be embedded through checklists, digital prompts, brief reflection tools, and reinforcement systems that support independence without reducing academic rigor. Executive function supports are another essential layer. Many students in special education experience challenges in working memory, inhibition, cognitive flexibility, planning, and task initiation. Visual schedules, chunked directions, graphic organizers, timers, and explicit routines reduce cognitive load and increase predictability. These supports are not simplifications of learning. They are access tools that enable students to participate more fully in instruction and demonstrate competence. CBT in special education must be implemented with fidelity, cultural responsiveness, and strong collaboration among educators, families, and related service providers. Interventions should be individualized through the IEP process and aligned with functional needs, not just diagnostic labels. The most effective practice combines direct instruction, guided rehearsal, progress monitoring, and data-based decision-making. In this way, cognitive behavioral and self-regulation interventions become not only behavior supports, but also mechanisms for academic access, emotional growth, and long-term learner autonomy.